You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, how small improvements to your smile can literally change your life. We're talking about smile makeovers today, how affordable small improvements could really make a big difference in your appearance and how you feel about yourself. With us, we have San Diego's cosmetic dentist, Dr. Dankworth. Dr. Dankworth, welcome to the program.
Thanks for having me on, Randy. I appreciate it.
Now, before we get into today's topic, tell me about your practice. You work with your wife. You guys are like the San Diego, cosmetic dentists?
That's correct.
So who's a typical patient, and what are the different procedures that you do?
Well, you know, Randy, I do work with my wife, and I've had the privilege of working with her for 26 years now.
Where'd you meet?
And we met in dental school. It was a dental school romance, and it's not so odd these days, but we have had a great time practicing together. We really complement each other. She has strengths and that I don't per se have. Some people like a female dentist. They really would prefer to see a female dentist than a male. And so it's great that our office and our practice that we can provide that for our patients.
Are there things you do that she doesn't do and vice versa?
Vice versa. And so we really complement each other that way.
And nobody likes going to the dentist.
You know, maybe initially they don't, Randy, but with us, it's a whole different story. You know, we've been specializing in especially on the sedation side of dentistry and dealing with high fear patients, because I don't know if you know it or not, 25% of the population out there is terrified of the dentist. And we have an approach to them that not only allows them to be much more comfortable when they're having their dentistry done, whether it be a smile makeover to basic cleanings to everything, and it's something that has so drastically changes their lives and their perception of the dentist. They end up loving coming to us.
Now, one of the things that I wanted to point out, and people need to know, this is a real interview. I'm not on your side. I'm not endorsing you in any way, but I am endorsing your work. And I have discussions with people all the time. They say, yeah, I'm going to go get some veneers at my dentist. I'll say, well, do you know if he or she has the training? Have you looked at their before and afters? Because there's a lot to it, right?
No, you're absolutely correct. And
I mean, they all aren't doing it the same.
No, the best of the best have had extensive training, and that's something that both my wife and I have done over the years. And dental school really just prepares you for the basics. That's it. Doing fillings, doing really basic treatment, but when you're talking about transforming somebody's smile, that's a big deal, and that takes a lot of artistry, and it's something that just isn't taught in dental school.
So you've had a lot of continuing education to learn cosmetic dentistry.
Oh, absolutely. And between myself and my wife, we've taken years and years of courses, and I've been doing porcelain veneers and doing cosmetic dentistry for the past 20 years.
Is there that much to it, by the way? Because you're always going to courses. I mean, is there that much to it?
Oh, absolutely. And I feel as though professionally, I never feel as though I've arrived. I know it all, and that's to my patients' benefit.
Because it doesn't cost more to go to somebody that is focusing their practice on cosmetics.
Not necessarily. Right? No, not necessarily, Randy. That's not always the case. And so it's important for individuals that aren't happy with their smile and have always been self-conscious about their smile, to really do their due diligence and to go in and interview and meet the individuals that they perceive can change their smile and change their life.
But now the only way, though, really, you could tell as a lay person is look at the photos. I mean, that's at least, am I giving bad advice? Because I look at your photos. I mean, these are some of the best I've ever seen. And like I said, I'm not trying to endorse you here. But don't you think you need to look at the photos?
Oh, absolutely.
I mean, that's almost the main thing.
Oh, images are important. However, I also encourage my patients that, especially the new ones that are coming in and that are kind of checking us out, I like to ask them, or I offer to them, and not all of them take me up on it, but I'll say, hey, call this patient that they're looking at their photo, and ask them what their experience was like, and where they started, where they are now, and how things have changed for
I mean,
them.
you say that you're changing people's lives. You believe that.
Oh, Randy, there's no question. Every one of the individuals that I brought today, they have there's stories with each one of them. I mean, whether it's they got married after they got their new smile, or whether they got the promotion that they've been waiting for, or whether they've started a new career. There's great stories with each one of these individuals how just changing their smile changed their life.
But you're a dentist. I mean, it doesn't surprise me that you think the smile's pretty important.
Well,
how important is the smile?
Well, think about it, Randy.
Okay.
Okay, I'm a dentist. You're right, and you might say I have a vested interest in this procedure, but really, if you stop and think about it, even the most beautiful people in the world, the cover models of Cosmopolitan, you take out a tooth, or you alter their smile. Are they going to be on the cover of that magazine? No, and that's and that's beauty, and that's just beauty. But a smile, as I see it, everybody's had a personal interaction with somebody where they've looked at somebody's smile, and they've been really so focused on, oh my God, what's happening with their teeth or their smile, that they've either been it's affected how they perceive that other person, made those judgments about who this person is, or oh my gosh, why aren't they fixing this ugly tooth that's right there in front of their face. And in my own personal situation or my own personal interaction, I've refused doing business with somebody that way.
Really?
Yeah. I mean, I walked off a car dealership, when the general manager came out to engage me, and I was ready to buy a car. And I literally, after 5 minutes with this guy, I couldn't get over the way this guy, his smile was so horrible that I just walked off the lot.
Interesting. Well, the other side of that is, I guess people with bad smiles don't like to smile.
Oh, absolutely.
So like you say, and I love when you said that they're walking around San Diego and you just think they're hormonal or depressed or moody or a tough guy, when in fact, they don't like their smile.
Yeah, they're totally unhappy.
Interesting.
Yeah, they're totally unhappy.
Are there that many people that don't like their smile?
Well, we see them all the time, and when you actually question them further, sometimes they go years. I mean, even in a couple of these individuals that you'll see, where they felt that way their whole life. And they get to a point in their life where whether it's a midlife thing, where they just finally decided, you know what, I've got to do something about this. And each one of these individuals, Randy, when I finished doing their smiles, they said, gosh, why didn't I do this sooner? I mean, they had that regret that they didn't do it sooner, and and that was because of the immediate changes that they saw in their lives.
Okay, let's go to the photos for the sake of time. Now, you like these photos.
Oh,
You're proud of these photos.
Absolutely. Hey, this is my hard work, and I'm so proud of this, and so proud of the people, these patients that trusted me to help them get the smile that they wanted. So, yeah, I'm very proud of this. Right. I'm very proud of this. So, this guy is Ken, and if you look at this, look at his teeth. Mm-hmm. First off, I want you to notice that the picture that you're seeing there, we coaxed, cajoled, tried to get him to smile as big as he could, and that's it. That's as big as he would smile. And if you did see the rest of his teeth, you'd kind of go, oh, wow, those aren't so great. I can see why he doesn't smile, and that's the way he's lived. This is a very, very successful man. He's a MD, and this is as big as he can smile, and he's forcing it. And so he's gone years and years being very successful, but having this guarded smile, and he's not that guy. I mean, he really is a great guy. And so when we did his transformation, it's remarkable. It's remarkable.
What does he say on the consult?
He said, Doc, do you think you can give me a nice smile? I mean, can you help me? Because I hate my smile, and I've hated it since I was a kid.
Okay.
And I'm already seeing what his end result's going to be. I can already visualize it and see it. You know, my business manager sitting next to me is looking at him going, oh, this is going to be so good. This is going to be awesome. So, so his end result had such a huge impact on him. He ventured out in a whole nother career that he had always been interested in, and this was the nudge, the tipping that just tipped him over the tipping point to get him going.
Let's take a look at that after.
So this is his finished product, and look at that smile, Randy. Is that ridiculous or
Very
not?
nice.
I mean, that's awesome. Now that doesn't look like somebody who's always been guarding their smile, you know, just like the before.
So this guy walked around frowning all the time, or just didn't smile?
People thought he was just kind of a stick in the mud, that he was serious or, you know, just not happy, and it was just the opposite. And when I saw him a week after we finished his case, he said, Steve, you won't believe it. I've got women coming up to me and saying, God, you've got a beautiful smile. And really, I mean, that was music to my ears. I mean, that made me feel so good that we were able to help him get, you know, become the individual that's always been there. We just brought him out. And, you know, and even to the extent that he had always been interested in hypnotism, and he started a whole nother career, a side career from his medical business or medical profession, that it just opened the doors, in which he actually now performs on stage.
Is
performs
that right?
in front of people. Oh yeah, performs in front of people, and is now also helping professional athletes and through hypnosis to enhance their performance. And he's, I mean, just putting himself out there, where he would have never done that before.
But he gives his smile credit for this kind of a transformation?
Oh, absolutely. Absolutely.
Interesting.
There's no question about that. He would be the first to say that was, again, what I refer to as the tipping point, so for him. And Randy, there's a lot of guys out there just like him. You know, we can fill Qualcomm Stadium with everybody, all the guys in San Diego that are just like him.
That hate their smile.
That hate their smile and have been self-conscious about their smiles for their, you know, whether it's, you know, due to trauma or they just have had that smile their whole life, and didn't know what to do about it, and didn't know where to start.
What type of patients or what kind of people are doing these smile makeovers? Just the high-end group of people?
Oh no. We have 16-year-olds. We have somebody like this.
Okay.
Okay. This woman, you'll see,
All right.
is she's not a young woman. Let me put it that way. She's I would say in her 70s, and whitening wouldn't really change her. She has old dentistry in there, and she came to me and said, Steve, I'm not happy with my smile. Can you help me? Can you give me a prettier smile? That's really what Razy really wanted, was a prettier smile. And of course, in seeing her again, I can see what the end result is, and I was so excited with her because I knew where we could go with her, and her results were outstanding, and she lives in a community, and people have raved to her and her husband, you know, just how beautiful her smile is. And you know, I would honestly, Randy, it took easily 5 to 10 years, if not 10 years, off of her face.
Yeah.
So it's beautiful.
Let's take a look at this after. Wow. Very nice.
Now, if you look at the mouth, Randy, just look at the lips, then look at the teeth. You'll see that her teeth, it looks like an older or an aged smile.
Yeah, one looks like a young mouth.
Yeah, and now you look
Good
at
point.
the finished smile makeover. I mean, her eyes and the face too. She lights up, and the sparkle in her eyes that she gets when she smiles now, you know, it wasn't there before. So the end result for her is she feels great about herself. She smiles more. She's not self-conscious about her smile. You know, she's beautiful, and she feels that way.
You had people in their 80s coming to see you.
Oh, absolutely.
for smile makeovers.
Oh, absolutely. And it thrills me not only for smile makeovers, but for dental implants to give them back teeth that they lost for one reason or the other. But yeah, I just saw a guy today before I came over here, Randy, that he's 82. And we're transforming his smile, giving him a brand new smile, and he's excited. He's really excited about what he's doing. And so, we see this all the time, Randy. We've got, in San Diego County, we have a lot of, especially women, that take good care of their skin, Botox, derma fillers, and do all of these things to their external of their face. But one of the things that they forget, or sometimes they overlook, is how much impact that smile has on them. And so, and it isn't always sometimes huge changes, huge smile makeovers that can really accentuate all the other stuff that they're doing. But it's, the impact is huge.
I mean, you do see that, since I met you, because we had a little
Sure.
bit of this discussion.
Yeah.
Somebody might have, the Chanel bag and the Rolex watch.
Yeah.
And their skin is fabulous. Maybe they have a facelift. So they care about what people think about it.
Absolutely.
But then they have this old smile.
Yes, absolutely.
So is it their fear of the dentist? What's your take? Why they're not doing it?
Sometimes it is that. And well, I would say at least 25%, if not more than that, it is just fear, and a fear of the unknown, of, well, what's involved. And a lot of times it isn't so much money, it's more fear of the unknown, of the process. And once they come in and see us, talk to us, and see how we individually craft each smile to that individual to enhance who they are, to give them the optimal smile and the best aesthetic end result, then they start to become more comfortable.
Okay.
They do, and then they realize, I can do this. And like I said, Randy, before, every one of these individuals that I brought to show you today has mentioned to me after the fact that they wish they would have done it sooner.
Now, I know you brought more photos. What else do we have?
Okay, absolutely. Check
Okay.
this out. So she comes in and says, Steve, I hate my smile. My mouth is a mess. How can you help me? And, Randy, when you see the end result, this is a beautiful woman.
Okay.
And you see how, and she told me that she never smiled, because there's a reason why she never smiled. And when you see what her end result is, you'll go, oh my gosh, really? She lived that way for so long, self-conscious, not smiling, not letting that inner beauty out because of her smile.
So what was going on there?
She had old dentistry, old metal crowns, porcelain metal crowns, teeth that had decay in them or were breaking down. This is easy stuff for us. But to pull it off in the way that we did, it takes a little preparation. And
Okay.
and as you see, the end result is
take a look at
spectacular.
this.
Yeah.
Wow. And this is the woman that wasn't smiling
This is the woman that
for a long time?
This is probably 10 years that she didn't ever smile. And again, most people just like with Ken, get the perception of who they are as a person because they're not smiling. So they think that they either have attitude issues, they're that they're depressed, whatever. And when you're not smiling, it has such a huge impact on those around them. And people that they meet for the first time. Now look at the smile, the overall shape of the smile, and look at the teeth. Now, Rennie, your kind of claim to fame is that you can spot a fake tooth from a mile
I
away.
tell you that. I did say that.
And what do you think about that?
Yeah, well, that's a good point. It doesn't look phony. Like
yeah.
when I see the housewives shows and things like
Oh,
that.
they're almost over the top.
Well, that's what I'm afraid about veneers to begin
Yes,
with.
yeah.
Like ever getting them.
And a lot of people come in and make that comment too, and say, "Well, I don't want to, I don't want to look that way.
You don't want to be done.
Yeah, I don't want to be done." And as you can see with each one of these individuals that I brought today, they look real natural, and they don't.
So that's
look,
the hands of the dentist.
That's the hands of the dentist and the ceramist, the laboratory technician that we work with. These are skilled individuals that are highly trained to create the most natural looking restoration, whether they're veneers, crowns, bridges, whatever. And I have high standards of who I associate myself with on the laboratory side, as well as the other professionals that I work with.
Are you a perfectionist?
Oh, absolutely, absolutely. It's because I'm so passionate about what I do and how I do it. And our patients benefit from that because they get the best smile that they get the smile that they've always wanted, and they get the best from us.
You say by fixing your teeth you could add to your charisma.
Oh,
elaborate on that.
Well, again, it comes from if you're comfortable with yourself and you feel confident in yourself, you put it out there, and so that you get that promotion, you can get that job that you've been striving, or if you're being interviewed for a new position, that people will observe that, and it's not always on a conscious level, it's on a subconscious level, so they feel it. And so when you feel good about yourself, you just exude that confidence, and you achieve the things that you want to achieve. You become a hypnotist, and so
the surgeon turned hypnotist.
Yes, yeah,
because of his self-confidence.
exactly,
Very interesting. Very
exactly.
interesting.
Yeah, it's a wonderful thing to experience with these patients, and that's a really rewarding part of what I do. And
who would you like to, you're on this interview, airing on TV. Who would you like to see more of from this?
I would like to see anybody that's not happy with their smile, Randy, that really wants to make a difference in their life and in their smile. I don't say it glibly that we change smiles and change lives, and because in all of these cases that's happened. Okay, so here's another one, Randy, and again you look at, and this individual, she is a beautiful woman to begin with, and you see her smile, but when you look at this before, you go, oh my gosh. And then this is what we were referring to earlier, when women will take really good care, not just women, but women and men will take really good care of their face, their skin, do all these other things, but yet the teeth, they didn't address all these issues, in which she finally did come to me and said, I hate the way that my teeth look, and I really, how can you help me? What can we do to make things look better?
Okay.
And in her case, I mean, you see what this end result is, and
wow,
she's a knockout. She's so gorgeous.
What'd you do? I mean, these are just veneers?
Those are just veneers, and it was a real easy thing to do, but it made such a huge difference. And again, she was another one of those individuals that said, her love life from just that transformation just exploded. Now put the before and after side by side.
Yeah.
And now look at the difference in the shape. Now, a lot of artistry and really planning goes into this. And notice how those upper teeth on the before go actually the opposite way of her lip, as far as the curvature
her lower lip.
of her upper and lower lip. And if you look at the after, look how beautiful that those upper teeth just follow her lower lip line. It gives her a more youthful appearance. And not to mention, look how beautiful those teeth look.
Well, she looked like, I was trying to pull back from this. I mean, it looks kind of like, when you look at the before, it looks like whoever this is, you can't see the face, looks like a kid.
Yeah.
And now she looks like a woman.
She looks like
a
knockout woman, a gorgeous woman. All right, one more, Randy, and then we're done. So,
Good.
All right. And in this situation, again, this is real typical of what we see. You can see these old gray line around the gum line, which that's an old porcelain metal crown, and none of which we do that anymore. And that's so passé and so old school, it's ridiculous. And now, the fix for this is really pretty easy, really pretty basic, and most people don't really realize that. And so, as you can see on this final picture, look at how big and happy I mean, I say always look at the eyes, because the eyes tell everything as far as how happy that individual is. And when we go through, when we make these transformations in people, you see in their eyes, that they're so happy because their face just lights up.
Good. We're out of time. I want to thank you for coming on the show. So, okay, if someone is watching this and they don't like their smile, for
Please
whatever reason.
please have them call me.
So do something.
I would love to sit down with them and go through what their options are, evaluate, and see what their desires are,
Okay.
and see how I can help them.
And your wife's also a cosmetic dentist.
Absolutely.
So if they have to
Yeah.
deal with a female, they could go there.
If they're more comfortable with a female, she's awesome.
Okay, good.
So yeah,
Who's better, you or her?
we're both equally
equal.
skilled.
Good
We are
answer.
both equally skilled.
All right.
Yeah.
Thank you so much
All right.
for coming
Thank
on
you,
the show.
Randy.
All right. You've been watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.